we're faced with difficult decisions. These are unprecedented challenges, and so we have balanced the decisions that we have made in terms of protecting staff against the obvious need to provide a service to the community. The decisions that we've taken around the Mersey are cognizant of the fact that by closing the close observation unit, which we had designated within the Mersey for the last week or so as the environment in which we cared for the COVID positive patient, and by closing the ED during the day, it's enabled us to free up enough staff. Now, obviously, as I've said on previous days, we examine that decision and we examine the situation on an ongoing basis multiple times a day. But what we are doing is we are providing the capacity to continue to care for those patients where they are. We are minimising the need for or minimising the use of unnecessary movements between hospitals, which is a basic principle of outbreak management. And we're also providing certainty to the community that they know where their family and loved ones are being cared for.
Will all those staff that are going into quarantine be tested as a matter of course, or will it just be on a case-by-case basis?
We are offering testing to all of the staff. So, as Dr. Veitch has mentioned before, the guidelines indicate that testing should be undertaken in healthcare workers who are symptomatic if they're identified as close contacts. Owing to the difficulty presented by the reinterpretation of the definition, it's very difficult for us to clarify without an enormous amount of work that frankly would take more time than we would be comfortable with to identify whether those individuals are close contacts. So while they are currently defined as casual contacts, we're dealing with them as though they are close contacts. We're also not waiting for them to develop symptoms. It's important to note that undertaking testing on asymptomatic patients or members of the public or asymptomatic individuals is a difficult result to interpret. If it comes back as negative, it may mean that you haven't been exposed. It may mean that you have been exposed but are yet to incubate. Now, I'm not saying that so I remove the peace of mind of a negative result. What I am saying is that a positive result will help us to understand more clearly the extent and nature of the outbreak. A negative result will not mean that the individual can come back from quarantine. Instead, it will mean that at the time of testing, there is no evidence of infection. And it's very likely that unless the individual becomes symptomatic, they may not need to be tested again.
Yeah, so when you say that it's being offered to them, the testing, is it in their hands, or does the health authorities, we just potentially test everyone?
There is no indication within the guidelines to test asymptomatic individuals. The offer to test those who have been placed into quarantine goes above and beyond the guidelines. There is little merit in enforced testing, and we would certainly not direct that individuals without symptoms would require testing, but it will be offered to them.
So you said there are 51 staff at the Northwest Regional currently self-isolating, and potentially this could affect up to 100. How many staff are there at that hospital generally, to give the people an idea?
I think probably it's more useful to look at the staff that are spread across the Northwest and the Mersey. I don't have those numbers to hand immediately, but what we have undertaken is analysing the number of staff affected. And as I mentioned, and as you've highlighted, the overlap is something that we're still determining. But the capacity to mobilise staff from the Mersey and support them to do so gives us the capacity to maintain a service for those patients that are admitted. And also, I would highlight the collaboration and cooperation from hospitals across the state, the capacity to transfer patients from the ED. So it's important to note that patients who come into the hospital will be transferred from the ED, not from the ward, provides us with the flexibility to be able to continue a service to the community.
Did all states potentially misinterpret what a close contact is, or just us?
The misinterpretation, I wouldn't characterise it as a misinterpretation. There has been a reinterpretation. And it's important to note that although it doesn't seem like it, we're still in the first few months of responding to and learning about coronavirus. The experiences in other jurisdictions that have largely informed the reinterpretation, in fact, highlight the responses that we see in outbreak management. there have been experiences, as I understand it, this is discussed by the Communicable Disease Network, which is the expert group that advises the AHPPC. As I understand it, there were cases identified within an outbreak in another jurisdiction wherein individual medical practitioners who did not fit the case definition for close contact, and it's important to note that these are in the high-risk settings of outbreaks, who did not meet the 15 minutes continuous definition for a close contact, but did meet the cumulative definition, resultantly tested positive. And that's prompted the reinterpretation of the guidelines, and that has been undertaken on a national basis. It would not be, I think, an appropriate characterisation to say that Tasmania has single-handedly misinterpreted that. This has been a discussion that has been occurring nationally.
And when you say the patient from the Mersey is being moved to the Northwest Regional, are we effectively now going to, and I understand what you're saying about every hospital has a corona section in it, are we effectively now making the Northwest Regional Hospital the corona hub for the whole of the north of the state? Will all corona patients, including ones from Launceston, be moved there?
Not at all. So the escalation plan that has been developed by every hospital and every region, which is a basic principle of incident management, has an identified coronavirus site within that region. So there is a site identified within the Royal, there is a site identified within the Launceston General, there is a site identified within the Northwest region. It has long been an intention for the Mersey to stay COVID-free. As we've responded to changes in the situation, we have a gentleman who is COVID positive at the Mersey. That gentleman is being transferred and is being held will be held and treated within the COVID positive area within the Northwest Regional. And as I mentioned yesterday, we now have five. We have, as I mentioned yesterday, the 5 coronavirus patients that were being managed across the Northwest. 4 were in the Northwest Regional, 1 was in the Mersey. All of the coronavirus identified patients requiring hospitalisation will now be in the Northwest Regional.
You won't be moving patients who have coronavirus from Launceston to the Northwest so that they're all in the one hospital?
No. So in the management of coronavirus in the region, we apply and follow appropriate infection control guidelines within each hospital, and we clearly allocate one area within the hospital as the coronavirus sensible. It wouldn't make sense from an infection control point of view, or indeed from a patient flow point of view, to transfer this. I understand the appeal of having a single hub across the Greater North, but the fact of the matter is that we need to be able to care for individual patients locally. Our plans respond on a daily basis to what demand and load is, but they also, as I hope you would expect, go out to when the demand is significantly greater than it is now. And for us to meet that demand, we need the capacity to locally manage coronavirus infections.
Get a breakdown of, I guess, what roles in the hospital have been affected when you say a certain number of people have tested positive to coronavirus now. What are we talking? Doctors?
I'm happy to indicate that this. Yeah, I'm happy to indicate that this has impacted on medical staff, nursing staff, and allied health staff. I'm not convinced that providing an itemised breakdown is of assistance, and also, to an extent, in a small community, which the Northwest Regional Hospital community is, there's also the consideration that the individuals who have tested positive, individuals who are identified as close contacts, are still patients, and they're still members of the community and entitled to the same privacy and confidentiality as any other.
I understand that. We've had a number of people now, and it could just be Tasmanian gossip because we're all aware of what happens down here. But you've said numerous times that the ED at the Northwest hasn't been affected. It's just the surgical ward and the medical ward, and yet we've had at least 3 people contact the ABC saying that one of the patients is an emergency doctor at the Northwest. Is that true?
I'm not aware of that. But having said that, I'm also not going to go into individual patient details, either by inclusion or exclusion. To a certain extent, the challenge that's presented by the reinterpretation of the definition and the significant amount of work that the outbreak management team would have to do to identify close contacts is the very reason why we've decided to go above and beyond the guidelines. and take a significantly more conservative approach to quarantining staff than the guidelines would otherwise dictate.
I'm not sure who's the best place to answer this, but what more do we know about the man that's passed away, the latest case?
We're not really in a position to provide any more detail on that gentleman, out of courtesy, obviously, for what he and his family have been going through and what his family are going through now.
Yeah.
He's an elderly gentleman.
Could you say if he's linked to the Ruby Princess?
I'm not in a position to give that information currently.
I know that your role is the medical role here, but we have today heard from police about the number of people that they have stopped travelling around the state. Now, one of the best ways that you've been saying that we can help you out is to stay at home. From a medical point of view, how frustrating is it that people are still moving around the island?
Medically very frustrating. I mentioned a couple of days ago that I think there's an element of ignorance in why people move around. I think that there's an element of feeling invulnerable. I think it's selfishness. I recognise that there's a significant desire, particularly on a Good Friday, for people to get out and people to enjoy. But I would reiterate that if you want to undertake risky behaviour that only presents risk to yourself. Don't go out and bring disease home to your children. Don't go out and bring disease home to your parents. Don't invite disease into your house. I mean, we can't see coronavirus. Many of us have had no contact with individuals who have lost their lives or lost loved ones or been unwell. But there's no doubt that those hundreds of thousands of people who have lost their lives across the world, and for the 4 people who have tragically lost their lives in Tasmania, there is a desire on my part, medically, to see individuals realise that this is not just a cold. This is not just the flu. This is a disease that we are learning more about every day. This is a disease that is scaring doctors and scaring nurses and scaring public health officials nationally. And if an individual thinks that just going into a community on the coast to their shack that's full of retirees is sensible, or walking down the street in a group of 5 or 6 thinking that they're safe and protected, I'd just ask them to think again and potentially, medically, not be so selfish.
Does it scare you, Professor?
Absolutely. I think that we've done enormous positive work in Tasmania, and I think we're seeing that in the epidemiology, and we're seeing that in the way the situation in Tasmania is progressing. But I've spoken to my colleagues here, I've spoken to my colleagues across the country and globally. My background is in emergency medicine, and people are terrified and people are dying.
Are you terrified though, given how this has exploded even at the North West Regional? Does that just scare the bejeebs out of you?
I see the risk and I see the threat, and I see that we have work to do, and I do my best to get on and do that.
Last thing, are you able to give us an update on the number of cases in hospital now with this recent development?
I don't have that number on me, I'm sorry.
I'll just have one more. Sorry. Just on the drive-through testing clinics, is there a reason why the one in the northwest is in East Devonport and not in Burnie, where the outbreak is?
With regarding to our testing facilities, we're continuing to expand those across the state. So the locations in East Devonport and Launceston had been in planning for some time. I'm advised that the testing capacity that we have at Burnie, we have sufficient capacity, and indeed we have the ability to expand capacity at that site if needed. We're also rolling off, as we speak, mobile testing clinics. So should we need further testing to be deployed, whether that's in the Burnie region or elsewhere, we have that flexibility.
Can I also ask you,
with regards to the outbreak at the hospital at the moment, there's obviously continuing investigations underway to understand the cause of it. I have confidence in the staff that we have there. The measures that we're taking today go above and beyond and show that the government's highest priority is the health, safety and wellbeing of our staff, our patients and those in the North West community. We've also been proactive in the role that we have taken with the North West Private Hospital so that we have consistency across those sites. We've also seen the changes to the Mersey Community Hospital, and we know that this may impact some in the community, but these decisions are not taken lightly and they're taken in the best interests and safety of our whole community.
Can I just ask the same question that I've just asked about police? We have seen that police have sent 15 people home from their shacks. They've stopped 30 to 35 cars, but they've only charged 3 people. Now, the Premier said yesterday the gloves were off. He'd spoken to the Commissioner about actually prosecuting people. What's your message to police? Seems to be ridiculous that we keep on giving people second and third chances. Is it now time to start prosecuting everyone?
Hundreds of vehicles were checked yesterday and over today as well. We've knocked on hundreds of doors on shacks and we are responding to all the complaints that come in to ensure that they are followed up. The people that have been turned around, the people that have been sent home will be checked on to ensure that they're complying. I urge all Tasmanians to make sure you are following the rules. The police will not hesitate to use the full force of the law to ensure that there is compliance because, as was outlined by Professor Lawler, this is incredibly serious. It is selfish behaviour if anyone thinks it's appropriate to go to your shack, go camping, hook your caravan on and go to the coast. It is just not acceptable, and I ask all Tasmanians to follow the measures, and I know police are going to continue to be out and monitoring throughout the entire weekend to ensure that our communities are kept safe.
You've been spreading this message so strongly for such a long time now. Is it time to get harsher with the penalties? Is it time to get tougher? Because clearly it doesn't seem to be getting through to some people.
Well, the fact that we have charged 3 people, the fact that we have police in many settings around Tasmania turning around vehicles, knocking on doors and checking on Tasmanians shows that we are taking this incredibly serious. I want all Tasmanians to stay at home. It is important that they do so, and the police will not hesitate to charge more people, and indeed whether we need to arrest them or summons them, we will take all steps necessary to get this message across.
Make an example out of someone to make this, the message has been serious and it's been consistent, but at the moment the public's potentially not seeing the long arm of the law come down on someone. Do we need to go hard and make an example out of someone?
We have already seen an arrest earlier in the week. We've seen a number of people charged, and I can reassure Tasmanians right now, if you're doing the wrong thing, expect a knock on the door from the police. They are very focused on ensuring that we're protecting our communities, particularly our vulnerable communities. No one is above the law, and I expect all Tasmanians to be complying with the restrictions that are currently on.
Considering something like on-the-spot fines, especially for those that say have been turned around in the last 24 hours and then get caught doing the wrong thing again?
If someone gets caught after being turned around, I feel confident that we'll be doing more than just fining them. We want to ensure that these people understand the full extent of our prosecution. We can have time in jail. We can have $16,800 fines inflicted on these people. And even if the penalty is not enough, think about your local community and your loved ones. Do that for those people around you, even if you're not doing it for yourself.
We've had Professor Lawler's medical and a little bit personal opinion on this. How are you disgusted? How upsetting and frustrating is it for you and the government to, see that this is happening?
In an afternoon where I have announced that sadly we have seen another Tasmanian die from coronavirus, and I've also announced that we are taking operational control of another hospital, and on the afternoon that I've announced that we are going to be quarantining our medical staff, any Tasmanian that does not think this is serious has another thing coming. It is incredibly disappointing of anybody who is flaunting these measures. These have serious ramifications. This is about life and death. This is about putting at risk our frontline healthcare professionals who we need there to support us during this challenging time. And anyone that goes to risk the health and well-being of our healthcare workers will feel the full force of the law.
We've now got 4 deaths and a mortality rate of 3.6%, and while we don't have the scale of cases that we're seeing in mainland states, does this just really highlight how vulnerable we are here in terms of our ageing population?
We know that we have an older Tasmanian population here, and that is why the measures with regards to staying at home are so important. It is up to our whole community to take the measures that are appropriate to protect those that are vulnerable. We've also seen across Tasmania that we do have the flexibility of one healthcare system. This is why we have deployed additional resourcing to the North West Regional Hospital. This is why we have taken operational control of the private hospital, and this is why we are reallocating resourcing across the Mersey Hospital. We're ensuring that doesn't matter where you live in Tasmania, we will deploy the resources that we have to ensure that your safety and wellbeing are our highest priority.
Minister, the Premier said yesterday, and you also touched on it, that you're advertising for doctors from other areas of the state who are willing to go to the North West to help out, and the Premier actually said this was an excellent opportunity for training nurses to also step up and have a role. How many people have stuck their hand up to go there?
I'm advising a number of people that have put their hand up in our expression of interest program. As the management team there works through over the coming days in terms of the people that will be required to quarantine, we will work through that. The changes that we've made with regards to various wards and indeed the ED at the Mersey will also make sure that we have sufficient capacity across those areas. It's important that we do have the capacity that we need. We've also deployed additional senior staff to help manage this as part of the outbreak management team to ensure that every step that we need to take is taken. And indeed today we've shown that we're going above and beyond to ensure the safety of our staff, our patients and the entire community of the North West region.
On that note, I believe it's the Governor of New York has allowed for those training doctors who are due to graduate to basically start working early to help with the response. Is that something that you would potentially consider as this continues?
We've been actively engaging with the University of Tasmania with regards to whether it's nurses or doctors that are in their final stages of training. They have an important role to play. They have an important range of skills. It is important, though, that as we deploy potential workforces such as them, that we do it in a safe way. We want to ensure that our junior doctors and nurses, and indeed those ones that haven't yet graduated, are deployed into safe environments. So we're working with the university to ensure that deployments are safe for the individuals, but also exploring every way possible to expand capacity across our state.
It's something you are considering?
We'll explore all possibilities with the university, and I have to say I thank the university. They've played a very constructive role looking at new and innovative ways, and it's one of the opportunities we have here in Tasmania with our close collaboration with the university to explore innovative ways to be able to deploy staff across our whole state as this unfolds over the coming weeks and months.
Minister, are you able to say any more details about the man that's passed away?
Sadly, I don't have further details. I do want to pass on my sincere condolences to his family. It must be a very traumatic time, and it highlights for the Tasmanian community how serious this disease is, the impact that it can have. And I once again urge all Tasmanians to please stay at home. This is about saving lives, and every Tasmanian has a role to play, and every Tasmanian has the capacity to control their own actions and stay at home.
Great, thanks guys.
Thank you.